Welcome to the Learning Pines YouTube. We hope this video helps.
You begin now. Open the bio-check pouch and remove the strip carefully. Hold the test by the handle. Avoid touching the absorbent tip. You want concentrated urine, so use first morning sample when possible because HCG is higher then. Once done, either hold the tip in the stream for the specified 5–10 seconds or dip into a clean container up to the marked line. Follow the time stated by the kit. Make sure to lay the test on a flat, clean surface to start the reaction. Once the test is placed flat, start your timer and wait exactly the kit's recommended window. Timing matters because evaporation can cause false marks. You should see the control line first. It confirms the test worked. A second line, even faint, usually means pregnancy because it detects HCG hormone. If the test line is very weak, it could be early pregnancy or low HCG. Repeat in 48–72 hours to confirm rising levels. Make sure to avoid reading results after the maximum time window. You finish by disposing of the used strip in household trash and logging the result if you want to track it. If no control line appears, the result is invalid. That means the test failed, and you should repeat with a new kit and fresh sample. If results are unclear or contradict symptoms, repeat testing in 2 to 3 days or contact your healthcare provider for a quantitative HCG blood test, which is more precise. Finally, keep tests stored at room temperature and away from moisture.
Thanks for watching. Consider subscribing if we helped you.